Hi, everybody. Thank you so much for joining. I think a few more people are trickling in, but we don't have a lot of time and we have a lot of people we want to hear from. I'm Melanie Nezer. I'm the Vice President for Advocacy and External Relations at the Women's Refugee Commission. And on behalf of WRC, the Gender and Emergencies Group, and the Sudan Family Planning Association, I welcome you to today's briefing and thank you so much for joining us. Last month, our groups released a report called In Her Own Words, Voices from Sudan, where 22 women shared their stories about how the war has changed their lives and how they're helping their families and communities survive. Our panelists will be discussing their own experiences and sharing what they've learned. We have panelists joining us from Kenya and Egypt, where they're safe but moving around a lot, so please be patient with any delays or technical issues. I think that's it from me. I'm so pleased to turn this over to my WRC colleague, Sadia Kidwai, who will introduce and moderate the session. Sadia?
Hi, everyone. Welcome, and thank you so much for joining us today. My name is Sadia Kidwai, and I'm the Advocacy Officer at the Women's Refugee Commission. So today's webinar is entitled Overburdened and Under Siege, Women in Sudan's War. The war in Sudan is now coming up to its 20th month. I know many of us have been counting the days and the weeks since last April. The impact on civilians has been catastrophic. Nearly 12 million people have been displaced by the conflict, and more than 26 million are now facing acute hunger, with famine now taking hold in parts of the country. Sudan now, unfortunately, represents the largest humanitarian and displacement crisis in the world. We know that women and girls have particularly felt the sharp edge of the crisis, from starvation, repeated displacement, loss of essential services, and mass killings. The need for gender-based violence services has increased by more than 100% since the war began, while sexual violence has been used by armed groups as a brutal weapon of war, leaving women and girls with extreme emotional and physical traumas. But we also know that women are on the front line of responding to the crisis, including leading national humanitarian programs, establishing emergency response rooms, pioneering local community services, or advocating on the world stage for peaceful solutions and the protection of all Sudanese civilians. Frustratingly, though, women and women-led organizations continue to be underfunded, unsupported, and sidelined from decision-making and peace negotiations. Moreover, they're often targeted by armed groups. And that's why we felt it was so important to convene this webinar today, focusing on the experience of Sudanese women, but also the work of women-led organizations who are leading the response in Sudan. I'd like to welcome our panelists who will be sharing how they've been supporting Sudanese women through the war. We'll have with us today Dr. Limiaa Khalfalla Ahmed, the Senior Program Director from the Sudan Family Planning Association, Tahani Abbas Ali, General Director of Nora organization, which combats violence against women and girls, and Manal Taha, the Program Advisor on Sudan for the United States Institute for Peace. Between them, these women have decades of experience advocating for the rights of Sudanese women, often at risk to their own lives. So we are immensely grateful that they could make time to speak with us today. We'll also then be joined by Isadora Key, who's the CEO of the Gender and Emergencies Group, who'll be talking about our recent joint report, which Melanie mentioned and which is shared in the chat as well, which shares the stories of more than 20 Sudanese women who've been displaced by the war. Finally, technology permitting, we will hopefully be watching a short recording from one of our report participants, a young Sudanese student from Salha named Lubna Hussein, who will share some of the work that she's been doing to support her local community through the war. We'll be dropping the full biographies of our speakers in the chat during the webinar, so please do keep an eye out for that. They do have such wonderful track records and levels of experience, and we'd really encourage you to read what they've done so far. We do have a packed schedule and a lot to fit into the next hour. However, we are hoping that we can find some time to take a few questions at the end. So as the webinar goes on, if you do have any burning questions for our speakers, please do drop them into the Q&A box. It's the question and answer box we'll be monitoring, or into the chat as well. We will try our very best to get to them at the end, time permitting. So I'm going to turn over to our first panelist, which is Dr. Limiaa Ahmed. Dr. Limiaa, the Sudan Family Planning Association has been delivering sexual and reproductive health services across Sudan for nearly 60 years. Can you tell us about some of the challenges your staff and your clinics have faced during this conflict, trying to deliver services, particularly to hard-to-reach communities and to displaced communities? And also, if you could just share, what are some of the needs that you're seeing in the women and girls that you serve? Dr. Limiaa, please.
Thank you so much, Sadia, and thank you for WRC for this opportunity to have such an important joint venture project and report. I'm gonna talk about my own words. I'll give my testimony as Sudanese women and as a member staff in Sudan Family Planning Association who fled the war as a displaced to Egypt with my family. My testimony is gonna reflect the sufferings of women during this brutal war in Sudan. Sudan Family Planning Association is a leading organization in providing reproductive health services for women who are in need. And during this war, from the second day of the war, SFPA started to stand ready to support women in need. And I always start my speech with this statement: birth is an event that cannot be delayed, and ensuring safe delivery in humanitarian setting is a critical. So for us, we stand from this point, and we started to deliver maternal health and sexual and reproductive health for women who are in pregnancy or who are in delivering babies. And we have number of women who gave birth for their babies at our static clinic or mobile clinics. We also provided GBV survivors and rape survivors with sexual and reproductive services through the referral system to the public hospitals or to national organization health centers. And we also provide a post-abortion care and abortion care for women who have been survived raped. And in our static clinics in Red Sea and in Gadaref and in Darfur states, we have undergone number of abortion surgical operations in our static clinics for women who have been survived raped. And we also partner with national organizations to support women who survive rape or who have been undergone GBV with legal aid, and also with financial support for those who have been abandoned by their families or by their husbands due to social stigma of rape. We also try to provide safe spaces for GBV survivors in our static clinics across the country in 14 states out of 18 states of Sudan. Through our 15 branches, we have safe spaces for GBV survivors in a number of our branches. And now we have collaboration with public hospitals. They provided us with slots to establish safe houses, safe spaces for GBV survivors and for rape survivors, especially a public hospital in Adbara and in other states. Also for our medical teams and for our mobile teams and for midwives who are spread all over the country and being even relocated after the war, we provide the sexual and reproductive health services for women at the community level, for women in their houses, for women in the IDP sites. So our extended midwife networks, which reach to 1,494 midwife and community health workers, they are providing maternal health and providing services for pregnant women and helping women who are giving birth. So through these different modalities, SFPA succeeded to reach out to more than 12 million women who are in need for sexual and reproductive health through 33 million services provided during this war since 2023. And the important thing also, we are working in partnership with organizations, local authorities, and it's important to coordinate with humanitarian aid commission, as we are part of all emergency committees at national level and at local level, because we need to be directed to the areas where there are gaps in SRH services, or there are high number of GBV survivors. So we coordinate with Humanitarian Commission, we coordinate with Ministry of Social Development, VAU unit, and we also coordinate with all clusters, protection cluster, nutrition, shelter, reproductive health, and we are part of subcluster of GBV with UNFPA, and we coordinate in data collection, in capacity building, and also in sharing information, plus, economize resources to reach out to a large number of needy women and girls in IDPs or in conflict zones. Also, I just want to seize this opportunity to thank our development partners from UN agencies, from IBBF, Japanese government, Canadian, Australian, British, UK government for their generous support for SFPA to enable us to reach to the needy women and girls and to provide and filling the gap in the sexual and reproductive health services. I would like also to send message to international community, to NGOs, to donor community that Sudan Family Planning Association, women-led organizations, and local organizations will spare no effort to support needy women in Sudan, and especially GBV survivors and rape survivors by different range of services, but we are still under-resourced and we need to be supported to help others and to support women who are in need. I also believe that international frameworks and legal frameworks are also one of the important needs for us, especially frameworks like Women, Peace and Security Framework, because it support our efforts and our legal background. My final message is related to humanitarian actors. We're looking to see SRH is prioritized in your interventions, in your response, in your planning, and in your funding. And I also want to send votes of thanks to emergency room in Sudan and to women-led organizations in Sudan who are offering, a lot of services and support in a very critical, situation and in a very challenging situation. I thank you so much, and over to you, Sadia.
Thank you so much, Dr. Limiaa, for that really comprehensive overview of the incredible work that you're doing across Sudan in the most challenging circumstances. I want to turn over to Tahani Abbas Ali now. So Tahani, one thing Dr. Limiaa spoke about was the GBV support that SFPA is doing. We know that the war in Sudan has been described as a war on women's bodies because of the prevalence of sexual violence. This isn't the first time that we've seen sexual violence used as a weapon of war in Sudan, and I know that you have been advocating for many years on justice for survivors of sexual violence. Could you tell us just about your experiences of the women that you're working with at the moment? If you could share, what support are they getting, and importantly, what support are they not getting that they need? I'd also love to hear your thoughts on what you think justice and accountability will look like for survivors of sexual violence from this war, and what lessons we should learn from the past. Tahani, please, over to you.
مرحبا، السلام عليكم. شكرا سعدية. شكرا دكتورة لمياء. اسمي تهاني عباس علي. Human rights defender and feminist activist. I'm a General Director of Nora Organization for Combating Violence Against Women and Girls, based here in Nairobi. I will speak in Arabic. هأبدأ من كلام سعدية. بالفعل هي الحرب في السودان حرب خاضها الجنود على أجساد النساء والبنات في السودان يعني الحرب الآن يعني نحن داخلين على سنتين أو عامين من الحرب، لكن كلها على أجساد النساء والبنات للأسف الشديد. يعني وسط يعني الصمت، وسط يعني ظروف بالغة التعقيد، يعني الآثار اللي ظهرت في الحرب دي على النساء. يعني نحن كنا يعني السودان عنده خبرة مع الحروب، يعني مثل ما حدث في دارفور 2003، والنيل جبال النوبة، وحرب الجنوب أو ما تعرف بحرب الجنوب، اللي هي حرب بين شمال وجنوب السودان أدت إلى استقلال دولة جنوب السودان مؤخرا بعد 25 عاما من الاختتال. لكن الحرب الآن الفرق فيها إنها يعني كانت في يعني كانت في المدن أو في مناطق يعني المواطنين، فاستهدف المواطنين والمواطنات بشكل رسمي. يعني أنا في الخرطوم يعني أسكن على بعد 1 كيلومتر واحد من مقر القيادة العامة للجيش السوداني، ولدي أطفال 2، وأنا سيدة من ذوات الإعاقة. فكل كل الظروف اللي بنقدر نسمي نفسنا إننا يعني في الهامش، هي كانت يعني أنا جزء منها. وللأسف الشديد تم تهجيرنا مرتين، يعني مش مرة واحدة. يعني الحرب بدأت في الخرطوم وهجرنا وانتهكت يعني كل الكرامة الإنسانية للمدنيين، لا سيما للنساء تحديدا، للبنات. تم اغتصاب الآلاف من النساء، تم التعدي الجنسي، تمت الإساءة، وتم القتل والاغتيال. يعني أنا بحيي برضو أرواح الشهيدات التي قدمت، يعني قتلت الكثير من النساء والبنات في السودان، من الفنانات والمواطنات والنساء المدنيات، وقتلوا في الخرطوم العاصمة. الفرق بين الحرب الآن، حرب 15 أبريل، والحروب الثانية، إنها في سيطرة في مناطق المدنيين. يعني حرب يعني خاضوها الجنوب في وسط المدن. ال 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 إذا يعني كان يجب إنه نقيف على الآثار يعني منهكة ومؤلمة، مثل ما تفضلت الصديقة دكتورة ليميا. يعني يعني بدءا من الانتهاك في الحق في الحياة، الانتهاك في حق الحركة، تم يعني الحركة والتنقل، تم اختطاف العشرات من البنات السودانيات، ودي حالات موثقة ويعني متاحة ومبذولة في لجنة، يعني في تقارير لجنة تقصي الحقائق. وبرضو أنا بحيي نشاط المدافعين والمدافعات عن حقوق الإنسان في الظروف الصعبة دي، هم قدروا يوصلوا للحالات دي. تم الاسترغاق للبنات، وتم بيع البنات، وتم السخرة والعنف الجنسي، وكذلك العنف الجنس مقابل الطعام. يعني الآلاف من النساء والبنات تم استغلالهم أو استعبادهم أو اختطافهم مقابل بعد ذاك إطلاق سراحهم مقابل فدية من المال، أو تم برضو تمظهرات للعنف في الزواج الغسري أو الزواج الإجباري، اللي هو الزواج نتيجة القوة لأطراف الحرب. يعني تم تزويج طفلات دون رغبة آبائهن أو دون رغبتهم في الأساس، يعني لكن للظرف بتاع القوة الموجودة كان بيتم يعني ظنا من الحماية أو وفقا للظروف الاقتصادية، فتم تزويج المئات من الطفلات ومن البنات حتى صغيرات السن، يعني وفقا لحالات موثقة. يعني دكتورة لمياء ذكرت، يعني سبقتني في نقطة محددة. برضو نورة بتشتغل مع النساء والبنات المتعايشات مع مرض نقص المناعة البشري. وللأسف الشديد نحن فقدنا في الحرب دي أكثر من 19 سيدة وشابة متعايشة مع مرض نقص المناعة البشري للظروف المعلومة في القطاع الصحي السوداني، اللي هو تدمر بالكامل. وأنا بحيي وبشيد بجهود الأطباء والطبيبات وكل العاملين في الحقل الصحي اللي استجابوا للحالات الطوارئ وقدموا روحهم يعني نحن عندنا شهيدات من الصف الأول، يعني من المستجيبات في الصف الأول من لجان الطوارئ، غرف الطوارئ النسوية، فقدوا أرواحهم نتيجة لأنهم بيتنقلوا في البروتوكول من حتة لحتة تانية، وقتلوا، يعني قتلت مننا شابات يافعات شهيدات وهم بينقلوا الأدوية والبروتوكول الصحي لضحايا العنف الجنسي من منطقة لمنطقة، تحديدا في منطقة الحلفاية بحري اللي هي شمال الخرطوم العاصمة، ففقدوا أرواحهم. بشكل يعني الحديث يعني أنا كان المفروض أقول نبهوني، لأنه الكلام عن واقع النساء مؤلم ومر، ويعني نشعر بغبن تجاه ما حصل للنساء والبنات في السودان حقيقة. واحد من تمظهرات الحرب إنه أنا الآن موجودة في كينيا، وده ما الغرار، يعني أنا ما قررت ولا أمنياتي في يوم من الأيام. أنا يعني أنا سكنت في كينيا لأنه أنا يعني جيت لاجئة، يعني ويعني ما كان بالاختيار انه نحن نطلع برا بلدنا، لكن يعني نحن بنحيي كل الدول اللي استضافت السودانيين والسودانيات وحمت حياتهم في ظروف الحرب. لكن ده واحد من الحاجات الأساسية، ومثل الملايين من السودانيات، الملايين هم هاجروا دون رغبتهم الحقيقية ودون يعني وضعهم الظاهر. الحصل إنه برضو غير العنف الجنسي، القتل والتهجير والتشريد والفقر والفاقة، وعلاوة على كل هذا حصلت يعني فقدان الأحبة. يعني أنا بشكل شخصي يعني فقدت أمي في هذه الحرب، والآن فقدت يعني أغلب يعني أكثر من 53 من الأغرباء من أسرتي الغريبة، فبفعل الحرب. غير هذا وضع اللاجئات السودانيات في المهاجر، يمكن دكتورة لمياء تعرف أكثر مني في هذا، اللاجئات في دول الجوار تحديدا دول معينة يعانوا الأمرين، يعني لا يستطيعن الحركة، لا يستطيعوا الرجوع إذا طلعوا من دولة إلى دولة أخرى، لكن يعني دي في دول، وبعد ذاك يعني الوصول إلى الستاتس أو وضع إنه أنا لاجئ وفقا لقوانين اللجوء المعروفة عالميا بيبقى مشكلة كبيرة، وبيبقى فيه صعوبة في إنه نصلوا. اللاجئات بيعيشوا في أحلك الظروف، يعني النازحات داخليا وهم بالآلاف، يعني أكثر من يعني آلاف يعني كل الشعب السوداني الآن في 17 ولاية هو لاجئ في مناطق قريبة دي. برضو عندهم مشكلة، بيعانوا من مشكلة كبيرة جدا، وهي مشكلة ده النازحين داخليا بيعانوا من نقص كل المستلزمات الحياتية البسيطة، بدءا من الفوط الصحية، يعني بيستخدموا ملابسهم، بيستخدموا ورق الأشجار للطعام يعني للتعامل مع أمراض وأوجاع الدورة الشهرية للبنات. وبعد ذاك الوضع الصحي في دور النزوح، ومعاي زميلاتي السودانيات هم عارفين الكلام ده برضو، وبرضو الزملاء اللي بيشتغلوا في منظمات بتتعامل مباشرة مع النازحين داخليا، إنه انعدام للرعاية الصحية بشكل كامل. يعني أنا ممكن أحكي تجارب حياتية يعني يوماتي، لأنه أسرتي الآن في دور النزوح داخل السودان من الجزيرة. أنا من منطقة شرق الجزيرة اللي هي مؤخرا هوجمت بواسطة قوات الدعم السريع، والآن هم نازحين في شرق السودان، لكن يسكنوا القرى القريبة، لكن ما في يعني في المعسكرات، لكن يعني حقيقة الوضع يعني مأساوي. كل ده بدخلنا في مسائل العنف الجنسي. يعني نحن وثقنا العشرات وقد أقول المئات، ومعانا تانيين من منظمات المجتمع المدني والنشط المدافعين وثقوا الآلاف من الحالات، وعملنا جنبا إلى جنب مع لجنة تقصي الحقائق، وأودعناهم تقاريرنا ومع الأصدقاء الدوليين المحبين للسلام وللعدالة. لكن مسألة العدالة هي
Tahani,
واحدة من
Tahani.
أسباب الحرب.
No, sorry, I was just going to say we just have about 1 minute left if you
Okay.
don't mind. And also
I wanna go on
if you're able to, Hani,
التوقيت.
just speak a little bit slower just so the interpreter can keep up as well. Thank you so much.
I'm so sorry. Yeah, I'm so sorry. لكن حقيقة لما نجي نتكلم عن أوضاع النساء، يعني أشرت إنه يعني بيمتلكنا غبن شديد، يعني وكلنا يعني ما خضعنا لأي دعم نفسي مباشر، بل وجدنا نفسنا في إنه نحن بنحاول نحمل الأخريات والآخرين ونسد الفرقات ونعمل على المناصرة وعلى يعني اسمع أصوات السودانيات والسودانيين. لكن ده كله بيسحبني لمسألة يعني الخلل بمسألة المحاسبية. يعني استخدام سلاح العنف الجنسي هو بدأ في حرب دارفور في 2003. إلى الآن لم نجد يعني محاسبة وإنصاف، بل الجناة الآن هم على سدة الحكم، والآن هم بيكرروا نفس السلاح اللي هو سلاح العنف الجنسي لإخضاع الطرفين. للأسف الشديد بغذيه خطاب كراهية، خطاب مضاد برضه، وخطاب جهوي وعنصري. وظهرت لغة القبيلة اللي هي اللغة المبنية على العرق وعلى على الدين حتى، يعني وعلى السحنات، وعلى يعني تمت إصدار إصدار أحكام إعدام على النساء اللي هم بينتموا لقبائل من يعني اجتماعيا بتنتمي لقوات الدعم السريع في مناطق سيطرة الجيش، وتمت إصدار أحكامات على النساء. وبنفس المستوى الدعم السريع يعتقل النساء وينتهك بناء على انه هؤلاء النسوة تحت سيطرة الجيش، وهم نساء يعني مدنيات، نساء مواطنات سودانيات لم تحمل اي سودانية سلاح في هذه الحرب. لكن اوضاع النساء مؤلمة، واوضاع اللاجئات السودانيات اشد ايلاما. اذا انا بتكلم عن كاكوم، معسكر كاكوم وكيومبي في كينيا، هم يعني كثير منكم بيعرفوا، وانا اتمنى يكونوا في ناس شغالين. والمعسكرات ولو في اثيوبيا، ومعسكرات في دولة جنوب السودان، والمعسكرات في بيالي وفي كرياندونغ وفي يوغندا. انا سعيدة بالتقرير، لكن ما لقيت حاجة عن كينيا. اعتقد ما كان مغطي كينيا التقرير بتاعكم يا سعدية. لكن يعني في ظروف كثيرة، يعني صعب إنه الزمن يكفيها. لكن أنا موجودة، وحأرسل المداخلة برضو مكتوبة لسعدية، وإذا في أي حاجة أنا موجودة وممكن أغطي فيها. فأنا متأسفة إذا أطلت، لكن الحديث عن أوضاع السودانيات في الحرب يستحق منابر كثيرة. وأنا بشكركم مرة تانية باسم السودانيات وباسم اللاجئات إنه أنتوا اديتونا الفرصة دي ليسمع صوتنا في 16 يوم لمناهضة العنف. وأنا بحيي صمود السودانيات ومقاومتهم، وبحيي الحركة النسوية السودانية وين ما كانت، لأنه هم زي ما أشارت الدكتورة لمياء في اليوم الثاني للحرب نحن بدينا نتحرك، نعمل شنو ونعمل شنو ونمشي وين ونتجه كيف. فشكرا جزيلا يا سعدية، وأنا ممتنة ومتأسفة للإطالة مرة تانية.
Thank you so much, Tahani, for that really comprehensive analysis. And I think the way you presented, the prevalence of GBV is not happening in a vacuum. It's happening in this context of, long-standing, really social fractures that have been emerging over many decades. I wanted to turn now to Manal to pick up on that. Manal, Tahani talked about the challenges of Sudanese women now who are trying to maintain their activism while also being displaced, while also dealing with some of these tribal, ethnic, religious tensions as well. You've been working with many women's groups in Sudan and also across the region to support participation and the leadership of Sudanese women in peace and political processes. Can you tell us a bit about how women have been included or excluded in peace negotiations and political decision-making through this war, either at local or national levels? And in your view, speaking with women's groups now, what do you think the opportunities are for women's participation in current political processes? You're just muted, Manal.
I'm muted. Thank you so much for inviting me, and thank you for the Women Refugees Commission and Sadia for reaching out to me.
I would like just to start first about the women political participations. Let me go overview about what kind of peace process now is happening in Sudan or happened before since April 2023. There's two main major political processes or three political processes. Okay, there's Jeddah one. If it didn't, it reached to some agreement. Jeddah 2 failed. Jeddah 3, no, I mean, no, not yet. And then you have Geneva. So those are the three main major ones. There is some ceasefire between, it happens before, but not like a political process. It's like hudna or stop the war for some time so people, civilians can go for 16 times, and all of it failed in 1 hour. So that's what's the reality. That one was actually military agreements, but the main one that the two warring parties sat down and talked were in Jeddah and Geneva. So where is women on those two main initiatives? In Jeddah, first it was requested by the two parties is to be just military. Okay, military talk. Unfortunately, the peace business in Sudan or in many countries, they think and the security is the main businesses. So that's why women will exclude it, let alone if you are in patriarchal, militarized, masculine culture. So peace and talk about peace and security and safety, it's the main business. So that's culturally, it's there. Then let alone the two parties were militarized and military, so they will not include women by their type, by their way of they being structured. Of course, the RSF and SAF, no, both of them, there's some women in SAF, but they are not in that leadership to be part of the end negotiation. This is within. There is no, after the coup, there is a lot of, after the Sudan coup, after the coup came and broke out the transition, after the beautiful revolution we had, amazing revolution, at the transition, then we had the military coup. When the military coup came, the voice of civil society, specifically women's civil society, was very low. Okay, so what happened is when there was no pressure from women's society to go to Jeddah from inside Sudan. Okay, there is some pressure from outside, but was not enough. Because unfortunately, the mediators themselves, the approach of the mediators themselves, let me talk here about what is the process itself, how it happened, how the mediators actually handled this issue. The mediators themselves, they listen what the men in uniform wants, and they want only themselves to be in Jeddah and not women with them. This I'm talking about Jeddah, still coming to Geneva. So there is an urge from mediator to put down these guns. There's an urge. There is a famine is coming, so there is an urge. You have to stop this war. You have to stop this war, no matter what. And usually, this is our story. You exclude. It's not inclusive peace. They trade peace versus justice versus peace, and we just continue for 1, 2, 3 years, and we failed again in another war. So that is the story being repeated, and we see that in front of us, it's happening all the time. The urge to do a ceasefire as the military technical agreements dropped out all the processes for mediations. And if you know mediations has to be with the processes, because processes is important to gain confidence and to build relationships, either between the mediators or between the warring parties. That missing is a big part. Okay, then involving civilian voices, specifically women. When we say women talks about peace, they don't talk about their own safety. They talk about the community safety. They talk about the needs. They talk about what needs to be done to stop the war. And this women groups all over Sudan, all over the region, they developed priorities to stop the war at the first time, and then the second, the short term, the middle term, and intermediate term, and long term. These were started and was so comprehensive. And then this happened, the only team that actually managed to talk to the RSF and SAF was in Jeddah, Women Advancing Security Group, which I'm leading and I'm helping them. We use our own local connections, our own women power, which is relationships. We use that substances, and we call the two warring parties. We call the RSF and we call the SAF. We met them separately, and we put five points for them, and they included. They said, we want women to be included in all ceasefire mechanisms, especially monitoring and decision makings and observation and verification. We asked them to hold account the perpetrators and the violence against women committers to hold them accountable, the perpetrators. And also we asked them to facilitate for the aid, and so that was accepted by the two parties, and they promised that when they were in Jeddah. Okay, and we met with them separately online. We managed to do that without a lot of media, without a lot of support from outside. We just did it as Sudanese women. So we are in Geneva, we had a different approach. We know that the mediator is the US, and US had the sign in 1325. So it's a law for the US government to include women. So the Department of State and other partners, they know. Even the EU, they know. So in the Geneva is a different format. Geneva has a mediators, and which is the US, and then you have the close facilitator, and host is the Switzerland, and then you have Saudi also as part of the kind of co-mediating, but not actually mediating. And you have the ELP group, which are EU, UN, African Union, and technical group that they can facilitate for a lot of technicality. It happened that the RSF and SAF didn't came, but RSF came, and then the mediation, it didn't happen because you can't do mediation with one party and the other party is. So why that didn't complete it, why that process was not really actually happened, is because it's still the issue of urge to have solutions, the issue of missing the processes. So Geneva, it went like group went to Geneva. Okay, women were there, but the way where women were there is not because they've been invited to this political process. No, it's because the Office of Women Global Issue and USIP, which I work with, and they search for common ground. You have a partners on the ground. We learned that women will not be that in that discussions. So what we decided to work with our own partner in a workshop in Geneva. So the ambassador Gupta, the Global Women Issue, invited those partners. We are partner with them. Invited us to come out for workshop. Okay, to be close, to be just in the same place that they are. That just men are there. So it happened they didn't came. The men they didn't came, but we were there. So what happened? Women came together and produced amazing priorities, and they went and they submitted to the technical committees and ALB groups and the special envoy who met with them, the American special envoy. And they facilitated for a lot of discussions for the humanitarian aid as a focus area, because we know we have the famine that never happened in our lifetimes. It's a huge famine. So, and we have a displaced that has never happened for the last 100 years, more than Syria, more than Ukraine, more than Palestine, more than anybody. You have 15 million people internally displaced. And every day you have thousands of them. We have 2 genocides happening now and nobody talk about them. Okay, we had the displacement that I'm telling you, like now, I just received a report about 31,000 family in one camp. It's called Muaskar Al-Gharia, the village number 6 camp, okay, in Kassala state. They have 31,000 people, displaced person, and they have only 14 latrine, 14 toilets. Imagine how many women are they? We have 50 kids being reported malnutrition every day in this one camp. So we have this amount, and the international world doesn't take it as a serious issues. I don't know why. If they want to measure it with like an ethics, if the ethics is a human life and human cost, Sudan is a human cost for this kind of war. If they want to really look at that from that perspective, if it's political interest, I don't think people will matter a lot for them. So the international community the global power has to stand and to see Sudan as in with ethical view. Like the war in Sudan is really put us in our testing our ethicals. How we look about the human loss. Where is it? Just by where they die, where they lost, where they raped, or because it happened more than Ukraine, but still you have 2% of whatsoever amount went out to help other countries. So these kind of questions the international community need to ask it. And then
Manal?
yeah, thank you so much.
Just
Yeah.
no, it's okay. If you want to just take like 30 seconds to wrap up, please.
Yeah,
Go
yeah.
ahead.
I will wrap up and I say that, let me see my notes. So the most important thing for us to include women is to change the way the mediation is being taken place, to ask ourselves when women should be included. For mediation, it has to be from before mediations. And to get women included as mediators before everything, before even they counsel the two warring parties. That is the only way we can book a seat. This is the help from mediators. And for international community, I want to urge you, I want to ask you if you have any connections, okay, with the human rights defender, human rights documentation organizations. We have a lot of atrocities that not being documented in a legal way that can really keep the testimony to be used in the future for any legal claims. These testimonies are lost. That is why it's easy for politicians to compromise the justice versus political gains when it comes to the peace talks, and it became like power sharing between men instead of looking about these atrocities and how we can do reconciliation and can do some support for these communities. So we need that support. We need that human rights documentation in a legal way. Okay, I myself and Tahani, we work with these groups in the ground. We are happy to navigate and to help you, to connect you with the women in these areas, in these camps. Okay, we engage with them every day. And also another things, if you have any connections with international media, CNN, BBC, please, just tell them we need you to put some effort in Sudan atrocities. Nobody show the world how Khartoum was destroyed. Nobody. You don't know. We know it because you see it in the pictures in our social media, but no international outlets looked at that. I don't know how they value the human destructions. Thank you so much.
Thank you so much, Manal and Tahani as well. We are moving on with our program. We are a little tight on time, but I would absolutely request anyone who does have any burning questions to please drop it into the Q&A chat. Again, I can't promise we can get to everything. I see we have some questions there already. But on the subject that you raised, Manal, of documentation and of telling stories and of getting the stories of these Sudanese women out there into the world, I wanted to hand over now to my colleague Isadora Key, who is the CEO of the Gender and Emergencies Group, who will talk us through the report that we co-authored together along with the Sudan Family Planning Association, which looked at telling the stories of Sudanese women who were displaced by the war. Isadora, sorry, if you could just talk us through the work that you do and why we felt this report was important, why we chose a storytelling tool, and what we learned from the process.
Well, thank you, everybody. I would love to start by inviting you all to think for a moment about why you've come here today. And why did you decide to join this webinar? If you're like me, you'll often attend webinars. Please do put it in the chat. We'd love to hear what made you come today. What made you give your time to hearing about this issue? I would imagine that many of you came because you want to hear from Dr. Limiaa, because you want to hear from Tahani, because you want to hear from Manal, and you want to hear their stories, and you want to hear for yourself firsthand what is going on in a crisis which we know, as Manal said so well, is incredibly neglected and not enough attention is paid. But more than that, you wanted to hear it for yourself. I want you to think about that and really do put it in the chat. We'd love to see why you came today. It would be really helpful for us as we think forward future work and research on this. We think you've come because you want to hear those stories. And as I said, storytelling is an important part of the report in her own words. And just after I've spoken, We will hear a video from one of the participants of the study, Lubna Hussein, who's going to share her experience. And then now she's going to talk actually about an architecture project that she's part of to document what's happened in Khartoum. And in doing so, also talk about her life and her work. And as you said so well, the human cost of this war. This report is a collaboration, as is so much in the feminist space. We all needed to work together. So this is a collaboration between the Women's Refugee Commission, Dr. Limiaa, Dr. Sawan, and Dr. Hiba from the Sudan Family Planning Association, and from the Gender and Emergencies Group. We all brought different pieces of our expertise and knowledge to make this report happen and to bring this report and these important stories to you. The first thing that was done was a scoping study. Our role as a Gender and Emergencies Group was particularly to look at how do we produce gender analysis in Sudan in an ongoing conflict. And the first thing that we looked at with WRC and with Dr. Limiaa and SFPA's help was a scoping study to understand what had already gone before us. What we saw were many, many assessments. We looked at the period from April 2023 through to September. We saw 18 assessments had been carried out. 2/3 of them had not looked at gender issues at all. They did not contain any sex age disaggregated data. The majority had ignored the voices of women entirely. They just didn't have any data. The sad truth is they possibly did collect that data and then didn't present it as such in their reports. So there was a real gap in the overall needs assessment, the overall collective understanding of what was happening in the space, and the specificities, as we heard from Dr. Limiaa, Tahani, and from Manel, that are happening and affecting women and girls in particular. So the first piece was about what else was, the first action for a gender analysis is to understand what do we already know about a situation. That's the first thing we looked at through the scoping study. And that scoping study is available. You can read it, it's published. We want to make it available for future researchers who may want to continue this work and keep looking at these issues. The second thing we looked at was the rapid gender analyses that had been made available for Sudan. We know how important rapid gender analysis is in rapid onset crisis and conflicts for making sure the key issues facing women and girls are heard. And there had indeed been 4 rapid gender analyses reports prepared by UN Women, by CARE, and by PLAN. And I'm delighted to see those organizations on the call today. Thank you for your important work, making sure those rapid gender analyses reports were available. We appreciate it and we use them. Thank you. It was clear, however, that there was more information as a year into the conflict, as we were looking at this, more information and more, as Manal said so well, the human face of the conflict, the stories, the lived experiences were not coming out as clearly as they could. And it's for that reason why we thought that more gender analysis of Sudan was needed to shine a spotlight on the issues that women and girls were facing, needed to make sure that we could hear their voices and share that lived experience in another way. And that really is why we looked for, when we moved into the data design and collection process, of storytelling. This is the first rapid gender analysis that we've written entirely dependent on storytelling. And it won't be, well, I'm sure Dr. Limiaa won't mind me saying this. At first, Dr. Limiaa's got a PhD. She's a medical doctor. She is an incredible, extraordinary human. But when we first talked about storytelling, she said, Izzy, we need data. We need data. Stories, really? Are you sure? And, WRC asked the same thing. My own team at Gender and Emergencies Group were like, Izzy, really? Just stories? I think this is going to be the way we can capture something different, share something new that hasn't been captured before. And we know how important and effective stories are. Hearing firsthand people's experience is an incredible way to connect. And so we designed this gender analysis process to collect stories. And we actually got far more stories than we expected. We thought about 10 women and girls would share their experiences with us. In the end, 22 women and girls chose to share their stories with us. Twice as many, more than twice as many than we expected. We expected everybody to remain anonymous. In the end, almost the majority of people chose to have their name and sometimes their photographs in this report. The fact of being heard was very important to them. This report is all about sharing those stories, sharing those lived experiences. And if you do nothing more than read the report, and pick out one story you will have done and responded to the consistent ask that we heard from women throughout Sudan, the women we spoke to from Egypt and Chad and in Uganda, women like Tahani in Kenya as well. They want people around the world to engage with the stories, to know what is happening in Sudan right now. So please, please, please click on that link, open up a story, engage with a woman's lived experience, because that is what she wants you to do. Women of Sudan want you to hear their stories. They want you to hear their voice in their own words. And that's what this report is all about. It's a collaborative effort. I really need to thank the 21 members of the team from the Sudan Family Planning Association who joined the training on rapid gender analysis and collected these stories. I need to thank also the Gender and Emergencies team who collected this data, a team made up of Amira Taha, Samar Eid, and Tayona Adams, who are on this call. Thank you so much for your work and dedication to this project. And of course, the WRC team. And Kelly, thank you so much for all your work shepherding this process as well. So I want to acknowledge that. I also want to acknowledge how important it was to take care of our well-being of the team as they collected this data. We know that mental health is a key theme of the report. Tahani has talked about it in her intervention. Dr. Limiaa has mentioned it too. I'm sure Manal would as well. But we made sure thanks to the Headington Institute, to look at psychosocial first aid for those collecting data as well. And that's a good practice that everyone should look at and consider when they're collecting data, particularly in difficult situations. That is more than enough from me. I can go on at length about this data. I want to thank deeply and from my heart Dr. Limiaa, Dr. Sawan, and Dr. Hiba from SFPA for making this project possible, along with all your colleagues, everyone from WRC and the Gender and Emergencies Group for doing this. And I want to thank you really for joining us today. It means the world that you've come and you want to hear these voices. I'm now going to stop talking and magic is going to happen. I am going to stop being spotlighted and I'm going to keep talking as I present the very first video from Limiaa Hussein. Limiaa's 24 years old. You're going to see a video of Limiaa talking about her own experience. As I said, it is an incredible story. She's a student in architecture in Khartoum. She lives just outside of Khartoum in Sahel. And she is such an activist, both a youth activist, a feminist activist. And we're going to be very privileged to hear her voice and hear what she has to say. Thank you very much.
Just want to confirm that everyone can see the video on the screen.
Yes.
Great, wonderful. All right, let me play that now.
أنا نحن جابر في سنة قلب اليوم السودان واليوم تقولون بيرفع سبيع ماريا كنت جزء من تطوع جزء من مبادرات وأنشطة مختلفة بما فيها البرنامج بتاع الميزانية العربية يوم واحدة من فئتان امرأة في صالحة البرنامج كان مخصص لأنه يعزز المشاركة بتاعت النساء الاجتماعية والسياسية. سيد البرنامج بعد ما خلص الفترة التدريبية بثنا عدد من الأنشطة لتنتج سطحية. الأنشطة كانت كانت تحسين وتبرير دور المرأة في الامتحان الأولاد للتحديد. بعد من الأنشطة اللي أنا شاركت فيها برضو أنشطة مختصة أو متعلقة بقضايا حقوق الإنسان. منها كان برنامج لغات مواصفات الخطاب العالمي. البرنامج كان يحاول يعرف الناس بأن تعرف حقوق الإنسان ويحاول يوصل المفاهيم بتاع الحرية والكرامة الإنسانية مثل في نظام الصياغة تاعته يتركز المركز بتاع كافة العدلات في إطار التوصية الدرسية بقضايا بحاجات حقوق الإنسان. وبالتالي كنت مؤهلة لأنه أنا أشارك في إنه أقدم حملة تدريبية لشباب فاعلين آخرين ومبسوطين تعليم من مجتمعات مختلفة. في برنامج كان مصمم لأنهم يتعلموا أكثر عن الإعلام عن حقوق الإنسان ويتعلموا أكثر عن بناء برامج التخطيط الاستراتيجي. بعد الحرب جت الحرب وقصت كل الأنشطة دي طبعا. بعدين بقت بداية جديدة بالنسبة لنا كلنا. ممكن تكون كانت بداية كابوسية أو كانت مرعبة بالنسبة لأغلب الناس بما فيهم أنا. تقريبا بعد 5 شهور أو أكثر أو زيادة من القصة لشتة معينة اللي هي صالحة ما صالحة. بدينا نحاول نخطط لنشاط معين كان بدينا نحاول نعمل المدرسة الهدف النتيجة بتاعتها كانت قامت إنها تحاول تدي فرصة للأطفال إنهم هم يحصلوا على حقهم في التعليم زيه زي أطفال تانيين في العالم. فده كان الهدف الأساسي بتاعي. بعدين حاولنا نطور في الفكرة أكثر، حاولنا نخلي المدرسة تبقى زي منفذ ومركز بالنسبة لهم، وضفنا فئات ثانية إضافية متدرسة فئات بتاعة النساء والفئات بتاعة البنات. كانت المدرسة زي إنها كوميونتي سنتر أو مركز اجتماعي عشان نحاول نساعدهم إنهم يلقوا مساحة آمنة يعبروا فيها ويقدروا يساعدوا إنها رئيس رسالة مواضيع يساعدوا عنهم مواضيع بتخصهم. المدرسة تأثير على المجتمع كان إيجابي جدا، يعني بسط الحياة في المنطقة والناس بقت بادئة أكثر إنها تشتغل اللي فقد بسبب الوضع الأمني الصعب جدا. من الأنشطة الثانية اللي شاركت فيها بعد التحرك اللي هو برنامج في ذات الصيانة بتاع الرجال ذاته أو العمارة، برنامج بيحاول إنه هو يوصل أو مشروع بيحاول يوصل للعمارة السودانية مثلا لأنها في الحرب ده بتدعوا بالهدف بيحاول يوصل ليها ويعمل مكتبة رقمية كبير شديد للعمارة السودانية. أنا حاليا جزء من المشروع كابتن فريق الدراسات في البرنامج بتاع فومن المعمارية. شاركت في البرنامج في الستوري تيلينج لأنه حاسة إنه الكتابة بس كويس شديد إنه يكون أصوات يسمعوها كنساء. ده بالنسبة في السودان مبسوطة جدا نكون جزء من الحاجة دي، وتعامل عظيم جدا. كوني بقى عندنا منصب بنقدر من خلاله نوصل بفصلنا.
Thank you so much, Izzy, for taking us through the storytelling project that we did. We are actually very, very close to closing time, so the time is tight. I am afraid we won't be able to get to the questions, but I do want to thank people who did submit some questions to the Q&A box. We have acknowledged them. I will drop my contact details into the chat, so if you do have any questions that you would actually like me to follow up with the speakers, I'm happy to facilitate that, and I'm sorry we couldn't get through everything today. Just as we close now in the last few minutes, I would really like to take this back to our panelists. We have a really wonderful collection of people in the audience today. We have people who work in international humanitarian response, people who work in Sudan, in the region with Sudanese refugees. We have people who work in policymaking and governance in the US, at the UN and beyond. So for our panelists, I want to come back to you and just ask you if you have one key message or one key takeaway that you would like everyone in this audience to take with them from this session, what would that be? So I'm going to go in reverse order, and if we could just keep them very brief to 1 minute so we're not going too far over time. Izzy, maybe if we start with you and then I'll go to Manal.
Very simply, please read the stories, read the report.
Thank you so much, Izzy. Manal, please.
For me,
or for Manal?
for one message that it's important to include women in any process because that is the only way for us to stop this war. It's important for international community to look for this war as one of the human crises now in this century. It's important for the media outlet, international one, to give some time and space for this war. Thank you.
Thank you so much, Manal. And Tahani, please.
شكرا. I have to. اوكي. يعني هي واحدة، لكن أنا بفتكر إنه توفير الدعم العاجل للمنظمات والمجموعات وغرف الطوارئ النسوية اللي بتقودها نساء، وسهولة أو مرونة التمويل. يعني في إشكالات كبيرة بعد هجرة المجتمع المدني السوداني خارج السودان. بالتأكيد عندنا صعوبة في السياسات بتاعت الدول المضيفة، لكن أفتكر يجب أن يكون في مرونة في عمليات التمويل للاستجابة لطوارئ النساء والبنات. وبرضو نحن عشان مسألة المحاسبة بتبتدي بالتوثيق الدقيق والتوثيق القانوني للجرائم والانتهاكات، بالضرورة تتوفر كل الآليات والمعينات اللي بتساعد الناس على الأرض والفاعلين على الأرض والفاعلين الدول في خارج السودان إنه يوثقوا بشكل مضبوط، وتوفير الدعم الإنساني كذلك للاستجابة للطوارئ الصحية وتحدث من دكتور لمياء تحديدا في مسألة الصحة الإنجابية. دي حاجة أساسية بالنسبة لنا، وبرضه توفير الدعم النفسي للنساء في دور الإيواء وفي دور اللجوء.
Thank you, Tahani. And Dr. Limiaa, please, your closing statement.
Yes, thank you, Sadia. And my message is to the international community. We're looking for your support and your funding for humanitarian response plan 2024, which has been launched by OSHA, Sudan. And also we are looking for more events like this and more support from women for women. And I think this solidarity between the North and Global South, I think one of the strengths that will support us as Sudanese activists, as national organizations, to support Sudanese women and to tell them that you are not alone. We are on your backs, we are supporting you, and we'll keep the promise. And I'm really proud to be part of this platform and this report. And I also proud to be a member staff with Sudan Family Planning Association and IPPF. Thank you so much.
Thank you so much, Dr. Limiaa. And on that note, I will close up. I know in the chat that there was also a request about sending biographies to participants and attendees. Yes, we will do our best to circulate those to everyone, if you didn't catch them in the chat. So as I close, I just want to say thank you so much, first and foremost to our panelists who, as we mentioned, are all women leading the work of supporting their country, of healing their country, of healing the women and the communities from Sudan, but have made time to speak with us today and to share their experiences. Thank you for your generosity. Thank you to our partners, the Sudan Family Planning Association and the Gender and Emergencies Group. And finally, thank you to all our attendees who joined us today. I hope this has been as enriching for you as it has been to us, and I hope you're able to carry with you these final messages and calls to actions from our panelists. Thank you, everyone. I hope you have a wonderful rest of your day.
Thank you so much. Thank you, Sadia. Thank you, everyone.
Thank
Bye.
you.
Bye.
Thank you, everyone.
Salama.